I'm Danielle Vandezande with Willow Breast Cancer Support Canada, and I'm going to be speaking about our programs and services that are available to people across the country who are facing a diagnosis, as well as their family, friends, and caregivers. Also going to be speaking a little bit about making the transition from being in active treatment in the hospital situation and making that adjustment to not having those regular appointments, but where do you go for support and information when you have questions or so on, but don't have the frequent appointments with your physician, oncologist team, etc. It is Breast Cancer Awareness Month. It is a time that I think some people who are right in the throes of breast cancer treatment look around and go, could you please leave me alone for 5 minutes? Breast cancer is kind of everywhere, right? You look in the news, you look at your mushroom pack in the grocery store, you look, everywhere you look is breast cancer, including in your life. So thank you for taking the time to be here today, and hopefully we can share with you a little bit more about some of the services that are available to you, both today and also in the days and months to come. For those of you who are part of the healthcare team here at ELLICSR or the University Health Network, hope this also gives you some insights too into where you can refer your patients or clients to as well. So as Rob said, I'm Danielle. I'm with Willow Breast Cancer Support Canada, and Willow started actually after the National Forum on Breast Cancer in 1994. Some women came together. There was this big gathering around breast cancer, and these women who had had breast cancer looked at one another and said, well, this is good. I'm glad they're starting to pay attention to breast cancer, but what I really need is to be able to talk to somebody who's been through it, and I need to be able to access information that I can trust. And those two pillars is what Willow was founded on, and that continues to drive us today. There's other activities I'll talk about a little bit more, but that whole concept of peer support and access to credible information can remain the pillars for what we do as an organization. So as you see, we are a national not-for-profit organization, and we are available to people across Canada who are facing a diagnosis, but also people that are at high risk. I'm going to talk a little bit more about what that means and what that looks like for us. But also, I think one of the things that is important to note as well is that our services are available to family, friends, caregivers as well. So people can connect. A lot of times, we'll talk a little bit more about some of the frequently asked questions that come through. And Rethink services are wonderful because they fit that very specific, unique needs for young women. Willow is for people across Canada and also of all ages, stages, and also family, friends, and caregivers as well. So we have our peer support service with our national toll-free helpline, which is the support that's provided there is provided by women who have been through breast cancer themselves, and they are both staff and volunteers and are able to provide both support. This is what worked for me. This is what I found helpful. This is how I got to be 10 years out from my diagnosis. Yes, this is possible. Yes, that day will come for you as well, and this is a little bit of wisdom that I can share with you of how I got to be here. But also we have our health librarian, and so that service is actually integrated. So when you call and speak to the peer support team, you're also accessing that credible information again as well. So, okay, so I understand what's happening in terms of, yes, I have a diagnosis, this is the stage and so on, but what does that actually mean for me? Take those statistics, right? And you talked about, you know, sort of this is your survival, this is your like long-term recurrence risk and all these numbers on a paper, but where are you in that? Where's you, the mom? Where's you, the daughter, the sister, the partner, and all those pieces? So that's a part of what we do as well, to access those credible pieces of information that allow you to make the decisions that are most important to you. So for some people on any given day, that is simply, how am I going to get through this week? And for others, it's bigger. It's around, I need to really think about perhaps taking a more aggressive approach to my treatment and what that might look like. So it's that whole span of questions that we're able to assist with. And also then to locate local resources. So we are, as I said, a national service. So people that are in Toronto are welcome to come into our office. We're actually just around the corner at Queen and University University. So if you wanted to stop by and visit, you can, but you're also welcome to phone or email as well. But we also can connect people with a local support group in their community, where to find a wig, other resources that may be relevant. For example, we have a publication, Coping with Your Financial Concerns, which I was saying to somebody earlier, I don't really know anyone who has faced a cancer diagnosis and not been sort of surprised, at least, by the cost of this experience, whether it's something as simple as parking at the hospital or access to treatment and other resources as well that go along with it. So that publication is a great resource for people and helping them to navigate some of those systemic pieces as well. And we do have a translation service in over 150 languages. I'm not going to list them all, but we do have some people that are part of our support team who are able to provide support in other languages, and then also we have a translation service for those that we're not able to support directly. Our token poster child, Angelina Jolie, she has not given us permission for that picture, but when she recently announced that she was BRCA mutation carrier and the subsequent decision making that she went through in terms of her surgeries, I think on one hand that raised the awareness in a way that's really helpful, but what it also has done is made a lot more people ask about, what's my risk? Like, do I even need to be thinking about this? And so one of the things Willow's been able to be helpful with for people is just discerning between, you know, you maybe have several family members who've had breast cancer or cancer versus having actually the genetic mutation. There's a big difference, right? And sometimes people sort of lump that all together. I don't know whether part of it is a desire to be a little bit more like Angelina, or maybe some of it also has to do with some of those fears too, which are really legitimate in terms of, I have seen a lot of cancer in my family. What does that mean for me? Or I'm concerned about my daughters and my sons, and what does my diagnosis mean for them? So the In Our Genes program was started to address the unique needs of the hereditary community, those who have the genetic mutation, but also has expanded our sort of community that we serve to include people who just want to know more and want to put perhaps some of those fears at ease. We can't say, you know, not necessarily, oh no, don't worry, you're never going to get cancer. I don't know that anyone can really say that about any one type of cancer. However, we can help people to discern and better understand where their risk factors are. And we do have a publication, Breast Cancer in the Family, What You Need to Know, and that goes through some of those pieces of, okay, discerning what's the difference between, you know, my aunt, my grandmother, and my uncle had cancer versus, you know, there might be some areas here that I want to talk to my doctor a little bit more about. Okay, and the community support program. So this is a program that, again, grassroots driven, started in the late 90s with Willow, and really was about women being able to come together face to face, right? I just want to sit down with somebody. And that's how a lot of this whole breast cancer movement started. 20 years ago, there was maybe a handful of support groups across the country, and there were definitely no pink cement trucks. But those women continue to offer that face-to-face support in communities that are remote and that are highly metropolitan. It really, it's interesting. People sometimes think, oh, you know, Toronto, there's so many support services, you don't need a support group, right? When I'm out in, you know, smaller communities, they're like, oh, Toronto must not have any groups because you've got it all in the hospitals, right? Or people are accessing all these services and you're so lucky. But at the end of the day, sometimes you just need to sit down with somebody face-to-face and say, oh, what, you too? I thought I was the only one who felt that way. I thought I was the only one who can't sleep between 3 and 5, and how do you get through those hours, right? So the community support program trains people to start peer support groups and sustain them at a community level across the country. And I've been working with that program specifically for about 7 years now, and it is my privilege and my pleasure to do that because it's really, really neat thing to be able to say to people, yes, you can access Willow's toll-free support and information service, but also let's build something at a local level, right? That continues to offer that support to people on an ongoing basis. Again, any age, stage, Shauna said that so well, she was so eloquent, but at any age or stage in their journey, there are people that still go to the support group, you know, once or twice a year, and they're 12 years out from their diagnosis, and that's simply about spending a little bit of time with the cancer, right? It's like, wait a minute, what? Spending time with your cancer? No, but it is about honoring the experience that you had. And so occasionally when your annuals are coming up, starting to get that nervous sort of here going, what's going to happen? Is everything going to be okay this year? That's an opportunity for women to go to these groups and just spend some time again with others who really get it. So that's a real neat gift, I think, that those support groups continue to offer to people. So I like to put this one up in terms of frequently asked questions, because sometimes people walk away and think, you know, Willow, yeah, that's support. It's nice to talk to somebody. But sometimes it really gets down to real practical things. Understanding pathology report, making treatment decisions. We're not going to decide for you. We're not going to tell you what to do. But you will be able to glean some pearls of wisdom in terms of what worked for other people, access to that credible information, and also somebody to listen. There's a lot of talking right? There's a lot of reporting that you have to do. Every time you go to an appointment, they want to hear, where's your numbers? Do you have your test results? Do you have this? Do you have that? Sometimes it's nice for someone to say, how are you? And then just sit and wait. So that's a real neat gift, I think, that the women that offer that support over the phone. And again, managing that anxiety, normalizing what's me and what perhaps is some of the drugs that I'm on, understanding some of those pieces of side effects as well. And then as well, the support for spouse or partner, family and friends. One of the stories I always like to tell is that, not to play on gender stereotypes, but oftentimes husband wants to know everything, right? I want to know what's going to happen from now until the day this is done. Right? And she's going, no, I can't even think past today, right? So it's a way for people to access the information they need that's right for them at that point in time. And people can call or connect with us as many times as they like or need to. And so some people call just simply, I'm having a bad day, right? And you need someone to listen. And other times it's, okay, now I've got some questions and I need some answers. So it's the whole range along that continuum. Did you know yesterday was Breast Reconstruction Awareness Day? All right, good. We celebrated the third annual Breast Reconstruction Awareness Day yesterday with 14 events across Canada. And really what this is about is not really promoting reconstruction, but raising awareness about it so that women hopefully have timely access to the options in a way that makes sense for them. So for a lot of women, understanding their reconstruction options ends up being about, you know what, no, that's not for me right now. There was a lovely woman there last night who said, am I too old? And I said, oh, absolutely not, honey. It is about making the decision that's right for you and where you're at right now and other things that are going on in your life. Other women say, absolutely, I can't have another needle, surgery, test along this way. I'm done with that for a while. I've got to walk away from that. And for others, this really, the whole process of reconstruction closes the loop on breast cancer, which is why they've chosen to use that as part of the logo. So ongoing, so that was the day, but the rest of the year, that continues to also be part of the service that we provide to connect people around understanding reconstruction options, navigating the system, and so on. All right. I'm actually not going to talk about how we help because we have somebody here with us today. Lillian, who's agreed to join us, who is a more recent member of our Willow family, but I'm not going to go on too long because you're going to talk a bit more about what worked for you. Come on up, hon. So Lillian has been kind enough to join us and share a little bit about her experience more recently, and thank you for being here, and I will pass this over to you. All right.
Thank you. First of all, I would like to say thank you to Willow and Danielle for having me so I can share a little bit of my experience with you. So my name is Lillian Yamananzu, and I was diagnosed with breast cancer the 2nd of November 2010. So it was an emotional shock. At that time, I was 36, and my 2 girls were 6 and 2 years old. So I had no support from nobody. So I underwent a mastectomy, a radical mastectomy followed by chemotherapy and radiation therapy. And it was a success, so I can say I'm a survivor. And I think that's amazing. It should be celebrated. But it's one thing to be a survivor, but it's another thing coping with cancer on a daily basis. And that's when the loneliness gets involved and the lack of support. So what I've learned along the way is that no women should have to deal with breast cancer alone. And thankfully there is support out there in the form of Willow, Rethink Breast Cancer. Lots of women are on the phone that can give you practical advice. I will give you an example. I'm on tamoxifen at the moment, and the side effects are quite heavy. You wonder, why do I get hot flashes all the time? Why am I getting so fat? And what's really going on? Is it all normal? So that's when you need to get the courage to make that call. And when you have the courage and you actually ask for advice on how to cope on a daily basis, you find that there's an enormous support group out there of women who have been through the same experiences. They've been through mastectomies, they've been through hair loss. They can tell you where to find a wig. They can tell you how to cope, let you know that you are normal, that what you're living is sad, but it's part of the journey you're going through. So just encouraging women to get as much information as they can. Support groups are out there, and they're doing so many amazing things like community outreach volunteers that can actually come to you and have a discussion about your feelings and the next step, or if you're worried about what to do, financial assistance. And just connecting with other women is also a huge part of the healing process, because you go through cancer, but then you have to recover, and that's when you need that connection. It doesn't always come immediately. We are women, sometimes we want to do it by ourselves, but when you get the strength to say, to pick up the phone and to say, I really need help, you will find that there are lots of people who, you are not alone. There are lots of people who are with you in the same journey and that can help you through. So it's hard, but there are many options, and the options are there are so many of them that it really goes towards the individual needs of every woman. Every woman can find what's good for her at a certain time. So thank you for having me, and thank you for giving me this opportunity, Danielle, to share with you.